Welcome to COVID-19 Local Impact Ottawa Valley. I'm Trevor Riley, and here we are going to take a look at the COVID-19 situation here in the county. At the latest update on April 6th, we had 2 new confirmed cases, which brings us up to 9, and no new deaths, which is at 1. Total tests done sit at 533, and an increase in negative tests coming back to 363, and we are currently awaiting the results of 161 tests. In Ontario, the number of cases went up by 309, bringing it up to 4,347. That's a 7% increase from the last report. 132 deaths have been reported, and the total tested in the province of Ontario has now reached over 78,000 people at the 10:30 a.m. update of April 6th. Now we are going to take a moment and review the declaration of emergency and the closure of all outdoor recreation facilities. In an effort to stop the spread of COVID-19 and keep people at home, the Government of Ontario has extended the declaration of emergency and emergency orders to April 13th. These orders include the closure of non-essential workplaces and the restrictions on social gatherings and events, among others. This includes playgrounds, sports fields, basketball and tennis courts, off-leash dog parks, beaches, skateboard and BMX parks, picnic areas, outdoor community gardens, provincial parks, and conservation areas. Coming up after a quick break, we are going to be taking a look at a presentation from County Council that aired on April 1st. Mike Nolan of the Renfrew County Paramedics spoke to Council about the actions being taken by their staff working on the front lines, and these times are tough, but the service is making sure that tests can be available and will be available for those most in need, and protection of our frontline workers is at the forefront of their operation. A reminder that the full presentation can be viewed on the County of Renfrew YouTube channel. But just before I go to break, I wanted to ask you guys for some help. Yes, you sitting at home watching TV, or even, yes, watching this on your tablet or phone right now. We want to know what you've been up to during this time, keeping busy, playing board games, playing video games, or even maybe getting that home reno done that you've been kind of putting off for a few weeks. Send us a quick video or a photo of you keeping busy with a short description, and we'll get that out to the people who want to see it. We want to share and share some of the positivity that's going around, because honestly, we could all use a little bit of positivity in our lives. How do we get these? I want you to send them to me, to trevor.riley@cogeco.com, and I'll make sure when I bring you guys the next update that I'll share some good news going on here in the Ottawa Valley. We'll be right back.
No hockey, no sports to talk about. You can't tell me your kid just did good in karate. You know what I mean? Like, friggin', there's nothing else to talk about. People aren't doing anything.
That's what's on Andy Barry's mind. A trucker for over 20 years, he's certainly seen the effects of COVID-19 while on the road.
It was a lot harder now that word's getting out. The communities and towns are pulling together and know that us truckers are in high demand, and they are starting to help us out.
Barry says he's starting to feel the effects of being on the road.
I honestly would rather be home with my family right now, but I know it's a necessity to move on, and we will get through this. No traffic at all. A couple big trucks we fly through, and especially down in the Toronto area, it's there's no traffic at all. Very strange. Yeah, normally it's bumper to bumper down there. Now you just seem to fly along. And actually the other day I passed a few different groups of people, and they all gave me the old honked the horn and seemed odd that it was a couple of grown couples, but just makes it feel that we're needed and they're happy for us right now.
Barry's wife is a nurse who works in the intensive care unit at the North Bay Regional Health Center. He worries about her health as well.
Yeah, well, her job seems a lot more scarier than mine, but we do a family walk every night and we keep our distance from our neighbors, but like I said, we'll get through this and hope for the best.
On April 1st, the County of Renfrew Paramedics Service gave Renfrew County Council an update on the COVID-19 pandemic. Chief Nolan updated Council where we were sitting locally in the pandemic phase.
We have significant exponential rise as was predicted. We know that is now starting to affect us locally. And I think that it's important that as we transition from preparedness to response, I would say that we are now very firmly at the beginning of the response. So in many respects, what we've been doing to date has been a hurry up to get to the start line. And I feel very strongly that we are just approaching the start line in terms of the impact of this within the county.
Chief Nolan discusses the now fully operational virtual triage and assessment center that has been launched in Renfrew County to meet the medical needs during this pandemic.
Because emergency departments and family physicians' offices and 911 need to be reserved for the most critical need in our community, we identified an opportunity to collaborate across the system by working with primary care, hospitals, long-term care, community-based care, and so on, to be able to stand up a new level of service. And I'm very pleased to say that this is now fully operational, 100% funded by the Ministry of Health, and we've been able to achieve that with our partners in really record time. What this allows and what we're encouraging is that if anybody in Renfrew County has a family doctor and they have a medical need, the first ask is that they contact their family doctor to be able to address that medical need. Typically, we're encouraging that occur by phone, wherever, whenever possible. Again, the goal here is to stop people from calling 911 or going to the hospital unnecessarily for all of the reasons that I previously stated. If you do not have a family doctor or you cannot get a hold of your family doctor, and that can be for many reasons, but the most common one is after hours, so in the evening or on the weekend, or again, if you don't have one, then we're encouraging the public to call this 1-800 number that's on the screen. And from there, that call will be received by either a family physician or a nurse practitioner or a community paramedic. Typically, the nurse practitioner and the family physician will provide you an assessment, will diagnose you, and provide you treatment over the phone or call in a prescription for pickup or delivery. This is critically important in that it differentiates from telehealth, because telehealth is an advice line. Here, we're assessing, diagnosing, and treating whenever possible over the phone. If you are more sick or more complicated than what we anticipate 80% of the people will require, then you're going to fit into one of two other categories. So the other 20 to 30% will be patients that we can't resolve over the phone, but may need a clinical assessment. We have the community paramedic response unit stood up to be able to do in-home assessments like we have always been doing in community paramedicine, but now sort of under the cloud of COVID or other medical issues. And our goal is to assess you, to connect back where necessary with the physician to be able to do consultation. And we can also offer remote monitoring, as we've been doing, as you know, in our community program for many years. So we can leave an oxygen saturation monitor with you, a blood pressure cuff, thermometer, whatever it is that you need to be able to stay connected to us. We now have a dashboard of patients that we're concerned about in the community and need to track very closely, as opposed to filling up our hospitals with patients who are not yet critical enough to require that level of care. So in doing that, The paramedic will also determine whether you need immediate direction to the emergency department, either by 911 paramedics or by your own means, because there's something that cannot be resolved safely in the home or monitored safely in the home. This is a really important cascade if you look at it, because if 70 to 80% of the patients we can manage safely over the phone and not have them come to the emerge or go to your family doctor's office or call 911, then we've increased the level of care and service, which actually works well for the physician community who can provide this level of service from anywhere. They can also be self-isolated, provide care from home, and the province has recently given them the ability to bill for those services like they were in their family doctor's office. And I think that that's a whole new landscape that we are taking advantage of first by creating a virtual triage model. Next, just to show you what that flow looks like, you'll call into a 1-800 number. 211 helped us get a number that allowed contact from anywhere. So all of the clinicians can be working from their own homes, answer the calls 24/7, complete a virtual visit. When necessary, trigger a community paramedic assessment. We can include remote monitoring, and only when necessary will a 911 paramedic or an emergency department be used. Go back to the original numbers we talked about, being that while today the frequency of use is low, but the acuity is going up. So the perfect storm is when the acuity, or how sick people are, continues to increase, and the volume then follows in terms of increasing. There's no reason to suspect that we're going to escape what others have been experiencing in this. So that's why we're planning this model.
The full County of Renfrew meeting can be watched via the county's YouTube page. For Your TV, I'm Tiana Tierney.